Let's look at the anatomy on the lateral chest radiograph. The position for the lateral chest radiograph is such that the heart is closest to the image detector with the X-ray beam going through from right to left. The resulting image has some layering of structures such as the two hemidiaphragms and the ribs. Note that this image is taken with the patient's arm over their head. On the left is the same image just seen, but on the right is a patient that has had her arms extended forward. Notice how this arm position obscures the superior mediastinum. The features indicated are structures that we will go through and identify. Look at the lateral X-ray to see the features in the annotated image. Notice the airspace behind the sternum and the heart. Now let's identify some structures. The darker loosened areas of the trachea with the dark spots as bronchioles, the esophagus behind the trachea, we've got the arch of the aorta. Using the CT image as reference, we can see the cardiac structures and relationships more clearly. First, we see the left atrium taking up the mostly posterior aspect of the heart, then the left ventricle below that on the anterior portion of the diaphragm. Then on the anterior surface of the heart, just under the sternum, is the right ventricle. This ejects blood out to the pulmonary outflow tract of the main PA. The little arch just behind that and above the green circle that is the left main bronchus. We can see the left PA just above the left main bronchus. Notice the lower circle is more oblong, and that's because it actually is the bronchus intermedius on the right side. Then we can also see the IVC poking up through the diaphragm. Finally, note the sharp and deep costophrenic angles adjacent to the spine. This is really important because a lateral chest X-ray is the most sensitive to detect even 100 milliliters of fluid in the pleural space. You would need double that on a PA view to see it clearly. So now, looking at the image on the right, notice how the vertebral column becomes clearer the more inferior it goes in the thorax. There are less soft tissue structures obscuring it. Also, the nicely domed-shaped diaphragms. This is another important feature to look for. The left PA arches up and over the left main bronchus, which is the lucency just below it. Notice the right PA is a bit bigger because we see the interlobar artery dropping down from it. The lucency next to it is the bronchus intermedius on the right side that travels along with it. A simple approach to the lateral view is the rule of thirds. The anterior chest border is 1/3 for the right ventricular outflow tract and 2/3 for the retrosternal airspace. The posterior heart border is 1/3 left atrium and 2/3 left ventricle. The diaphragm is the 1/3 left ventricle and 2/3 the remainder. Let's compare the normal image on the left to the pathological one on the right. What looks different to you? Take a moment and assess a few things that are standing out. On the right, we see there's more airspace retrosternally. Even anterior-posterior diameter has increased. The hilar features and vertebral column are clearer due to the increased air within the thorax. Finally, the diaphragms, they're also flattened. So there's more air trapped within the lungs or hyperinflation with these flattened diaphragms. This is indicative of chronic obstructive pulmonary disease. However, that's not all that's going on with this patient. What else do you see? Hint, look at the pulmonary vasculature. On the normal image to the left, we see the pulmonary arteries. The left is always posterior to the right. So what's going on with these structures in the pathology image? They're bigger and they're more opaque. These findings indicate that the patient also has signs of pulmonary hypertension with his COPD. So that hopefully is just enough to get you introduced to a few things that you should look for in looking at a lateral chest X-ray. Hopefully, you're much more comfortable identifying the structures indicated on this lateral radiograph now.